It's always fun when a patient realizes how painless dentistry can be.
From a medical point of view, if we can get the patient relaxed and at ease, then their whole body is just easier to work on.
A lot of times pain is anticipated rather than what is felt.
I think over 30 years of experience working with patients that it allows me to know the morphology of the oral cavity a little bit better. When we give an injection, we understand where we're going to miss nerves and to keep it pain-free for that patient. We let them be in charge of how the procedure goes by letting them know that if they're having a problem, that they can raise their hand and we'll stop immediately and assess the situation.
We find that if a patient is tense, everything seems to be harder for them. And so we have made that a priority to make sure that the staff genuinely care about the patient and help them to relax before we ever start the procedure. And when you have an environment like that, it's pain-free.
They normally don't feel the injections. The doctor's so good at what he does.
I think the key to painless dentistry is to not push it, not rush it. And I think that's one thing that our office does really well. We take the time that is necessary to make sure that you're comfortably numb.
If I can use the laughing gas, we can make them really comfortable. You know, and if people are really afraid, we'll use Valium and laughing gas.
I think one of the proudest moments of any dentist is when they're able to give an injection and have the patient look around and ask them if they've already given it.
I don't hear children cry. I don't hear adults get really upset.
And I've had a lot of people, and I mean a lot of people, tell me they don't even feel the injection.
I think I'm a personality where I don't like a situation unless I understand what's going on around me, and so I try to make sure that the patients, I walk them through the procedures as I'm doing them, before I do them, as I'm doing them, and then afterwards we kind of review what we did. We take as much time as is necessary, and we make sure that we schedule our patients so that they have plenty of time to be comfortable, be relaxed, be numb before we get started.